Welcome back, everyone. We're here with another Q&A. Anything we could talk about nutrition, keto, but that's pretty much it. Anything I'd say is not meant to diagnose you. Check with your doctor before implementing any of the information that we're going to share with you. And I just want to dive right in, Steve, and let's see how many questions we can get through today.
Well, let's do it. We're going to set a record by golly. So why don't we start with Eric from Rumble, not you, sir. What's the best way to lose loose skin after drastic weight loss? I have lost over 125 pounds. That gets you the ding of success. And let's see, need to get rid of some of that extra skin on my lower abs. What do we do for Eric?
That's always a tough one. Some of it can be improved by, the skin is an organ. So, using different types of fascial exercises, look up fascial stretching and strengthening and isometric exercises to maybe improve some of that. But the skin doesn't have contractile tissue, but the fascia just underneath it does. So I don't know how much of that you can get tightened up. It's really, when you lose that much weight, you're going to have extra skin. So there might be some other things you might have to do.
Yeah, well, anyway, fantastic achievement, Eric. So good for you. All right, let's go to Karen from Facebook. What is the best way to reverse insulin resistance? She doesn't speak of her diet or anything, but open question.
Well, I have probably 190 videos on insulin resistance. So think about what is insulin resistance. It's a situation where the receptors for insulin are downgraded. They're not actually receptive or sensitive like they were at one time. So then this whole thing is on a kind of a feedback loop, very similar to your thermostat. And so it's kind of like the controls now are telling certain parts of the body, like, we're low on insulin, so raise insulin, pancreas. So then we start getting more and more insulin. And now it gets worse and worse and worse because what creates insulin resistance is high levels of insulin. So the best thing to do is to cut down the things that trigger insulin, and that would be carbohydrates, especially starches and sugars. Starts cutting that out and then doing intermittent fasting. Those two things are going to be really important. There's other things you can do too, like berberine, apple cider vinegar, vitamin D, potassium, B vitamins. All these things will improve it, but I have a lot of videos on insulin resistance. I would start with that.
All right, very good. And Sadow 10, hearing from again, he was one of our inaugural contributors from good old Rumble. And today he wants to know what your opinion is on taking B12 injections. I've been eating B12 rich foods all my life, but still have a B12 deficiency. That's interesting.
I'm not crazy about it. There was a gentleman I talked to before he passed away. His name is not Royal Lee. It was Leo Roy. He was a good friend of Royal Lee. What's not good?
Well, he B12 injections, then he dies, so that's not very hopeful. Anyway,
he was just old.
Oh,
he was really old.
Sorry, I shouldn't laugh.
So he was a medical doctor. I talked to him before he died because he did a lot of B12 injections, and from doing it a long time, he said he probably would have not done that. There's other reasons why B12 isn't working. It could be that the form of B12 you're using is the wrong form. You need the methylcobalamin. It could also be that the stomach acid is not strong enough to help you absorb B12. It could also be something else, and you might want to look this up, called the intrinsic factor. Some people have an autoimmune disease, which are blocking this little intrinsic factor. It's something that allows B12 to be absorbed. Standard Process has a product with that in there. It's not called intrinsic factor. I think they use Zypan, it's called, but that also will help you facilitate the absorption of B12. Watch some of my older videos on this because there's a lot more to be said on this.
All right, good. Good luck with that, Sadow. Let's go to Anil C., also from Rumble. What are your recommendations for healing a diabetic foot wound?
Well, zinc actually speeds up the healing topical, and you can take it orally. But think about why a diabetic develops wounds in the first place. It's the circulation is going down. It's going to show up in the extremities first, your feet, your toes, and things like that. And so you must correct the root cause, which is the blood sugar issue. We need to. I would put you on a like zero refined carb diet, and then also take some of the protective factors that will really help in this. Benfotiamine is at the top of the list. Number two is alpha lipoic acid, and also I would even take a natural version of B1 in addition to the synthetic version, which has been benfotiamine, and just start taking a lot of that and start eating healthy and see what happens.
All right, very good. Let's go to Nala from YouTube. Good question for this time in society. Is storing food in plastic containers unhealthy? And I'll also add microwaving in them.
There is something that is kind of becoming more on the radar for most people is these plastics, right? I think we consume a bit too much plastic. I think we need to go on a plastic detoxification, and I'd start to use ceramic or glass, stainless steel. But in plastics, you have these things called forever chemicals, which means they take a little bit of time to break down, like about 1,000 years. So that being said, might not want to store them. Now, there are certain plastics that are not going to leach out. So you can look for those safe plastics. But I wouldn't say that's at the top of the list of problems to worry about. Like you wouldn't want to cook in plastic, like in the microwave, for example. Like you don't want to do that. And the water bottles are a big problem with plastic. So get glass, or there are starting to have like aluminum containers for water. So I have videos on this, so you can watch those for more data.
All right, very good. Let's go to Tanya from Facebook. Is it possible to reverse glaucoma?
Oh, yeah. Yeah. There's a great book. I know someone's going to ask me what's the name of the book, but it's translated in Germany from. I actually put it in the description in our last live, so you can look it up. But there's this book on using high doses of vitamin D3 for glaucoma specifically. Here's an ophthalmologist, a medical doctor who specializes in the eye, using high doses of vitamin D3 for glaucoma with amazing results. So you can't just use your 600 to 1,000 IUs and think it's doing anything. Unfortunately, the great majority of the medical profession doesn't like it when people take high doses. I don't even think it's high of vitamin D3 because there's been so afraid of that it's going to develop high calcium. But if they actually read the research, the real research, you would find that it takes hundreds of thousands of IUs of vitamin D3 over months to develop this hypercalcemic or high calcium situation in the blood. And even in those cases, there's people taking 1 million IUs of vitamin D3 and not getting this calcium buildup. So if you have the protective factors that control calcium, like magnesium and K2, that's going to actually mitigate a lot of the problems right there.
All right, very good. Why don't we go to the first thrilling question of the day, and there it is.
Okay. In what way can skipping breakfast extend your life?
All right, audience, climb on that. Let's go back to social media. David from YouTube, what are your thoughts about using eye drops that contain NAC, taurine, or hyaluronic acid? Are these ingredients we should avoid? Sounds scary.
No, I think these are good ingredients, but he was talking about eye drops.
Yes, sir.
So I'm going to release a video on cataracts that I talk about using NAC drops. Now, there's two types of NAC. Okay, you don't want to use the wrong one. You have N-acetylcysteine, which is great for lung mucus. It's good as a precursor to glutathione for your liver, for detox. It's good for a lot of things, but you don't want to put that one on the eye. The one that you want to put on the eye is it's called N-acetyl carnosine. Okay, that's a different thing, and it penetrates the eye because the N-acetyl is a carrier and then that last molecule, carnosine, really is good as a powerful antioxidant and a powerful anti-glycating agent into the lens of the eye to clean up some of the opaqueness. Now, so it's I try to find it on Amazon. All you can find is the remedy for dogs, with lots of people going, "Wow, this really works for my dog's glaucoma, cataracts." But it's interesting how you don't see any products on Amazon, but you can find them in other countries and purchase them in the U.S. And I think it's a great way to slow down and maybe reverse the side effects of cataracts. Now, the reason I'm bringing that up because you're not mentioning cataracts, your other eye conditions. There's apparently it's good for other eye conditions too, like glaucoma and other issues with the eye, not just the cataracts. So I mean, think about they do surgery for this cataracts. I don't know if it's just me, but if you're gonna do surgery on my eyeball, my lens, like to me, if I can do anything to prevent that, that would be a good thing. Because I mean, is it a permanent cure? Is it 100%? Is it safe? I don't know. But I'd like to do things more conservative first. So anyway, you might want to look at that.
Wow. Well, Terry, our producer, wanted to make easier for the people talking about glaucoma. The show that Dr. Berg mentioned aired on January 10th, so you can look back at that.
Oh, right. It was not last. Yeah. Okay.
Yeah,
2
time
weeks ago.
frame. So good luck with that. And let's go back to social media, where Mel from YouTube wants to know what would cause a man in his 60s to lose the hair on his lower legs.
That is usually, they'll say it comes with aging. It's a loss of androgens, testosterone. Because if you think about what causes the hair on the legs and the body, that's an androgen effect. So you're losing androgens. So welcome to the aging process. I have a lot of videos on how to slow that down. You should watch those. But yeah, that's low androgens usually. Now there are other conditions too. Sometimes they're a diabetic and they lose circulation in the lower legs, and then all the hair goes away, and it becomes very shiny, and the skin becomes very thin. That's a little different.
Well, I'd like a dose of that. I'm starting to look more and more like Sasquatch every year. All right, let's see. Not shy from Rumble. What pattern of fasting and carb restriction would help an 18-year-old male lose fat while adding muscle?
I think I would just do 2 meals a day, and I would make sure those meals are nutrient dense, and I would add a lot of exercise. And that way, I am releasing a video, I think tomorrow, where I interview my father on what they used to eat in 1948 when he was in fifth grade versus, and then we talked about now. Real interesting video. And I think what I came away with that with is in the grocery stores in 1948, they didn't have the huge category of foods they have now. Snack foods. They're all ultra processed foods. Chips, crackers. No, they just didn't have the volume of those. So they didn't have, I know this might be shocking, they didn't have Fruit Loops, I don't think back then, or Captain Crunch, or Cocoa Pebbles, to my knowledge. They had oatmeal, but they didn't have all this refined carbs that people are snacking on. Steve, isn't it interesting how, I mean, we're just like being pushed to snack between meals to make sure we are always getting nourished, right? Even with so-called healthy foods, like you better eat, through the day, and so you don't ever get hungry. I think that's really a bad thing. If we can just have 3 meals a day, that would be great, and no snacks, that would be great. But 2 meals is actually better, especially if you're trying to lose some weight.
Well, I agree. Kathy from Facebook, what supplements would help lower cortisol?
Ashwagandha is at the top of the list. It's an adaptogen. Magnesium also can help you lower cortisol. And then also in the video that I did, I think it was called Depression and Your Microbes somehow. You have to find that video, but I talked about adding L-Reuteri. It's a probiotic strain that you can cultivate and grow and make your own yogurt type thing And that raises this thing called oxytocin, which is a very potent anti-cortisol. It'll really lower your cortisol nicely, so it helps sleep and things like that. So those three things. Ashwagandha, magnesium, and L-reuteri, and of course, there's other things too, like vitamin B1, natural B1. So that would be a good start.
All right, very hopeful. The audience has started on answering, the questions, and the one that they just attacked was, in what way can skipping breakfast extend your life? And 70% of our respondents say it helps minimize insulin spike that naturally occurs in the AM. 20% say it improves the benefits of caloric restriction, and the final 10% say it extends the benefits of fasting on the body.
So everyone's correct, and
Yay.
when you don't eat as frequently, you allow your body to go into a longer fasting period, and then you start to increase something called autophagy, which is the recycling of old damaged parts. But you also stimulate a lot of other cool things, like the production of new brain cells, the production of mitochondria. So there's a lot of great things in fasting with extending your life, and cutting out breakfast would be a great first start. And Steve, do you think you're able to pull up this image that I gave you this morning?
You mean that one?
Yes, perfect. Okay, good. So I want to talk about this image. And does everyone's, I mean, I wonder, it's obstructing my, oh wait, it's just on my computer, right?
Yeah, you can
So
see the
it's
whole
like,
thing.
okay, good. So the reason I'm bringing up this image, because this explains everything in one image, what's happening. The On the on your left side, the image's right side, you have big food, junk food company, and then on the right you have big pharma, right? So when you think about it, what is big pharma doing? It's allowing the medical profession to use a treatment for an illness or a disease, a chronic disease, a symptom. I would venture to say that the majority of treatments for chronic disease involve ultra processed food, junk food. In fact, that's a significant factor, even though you'll hear there's no clear, strong evidence. That's BS. Can you keep that image up, Steve? So, so you're actually getting this idea that, oh no, it's not connected by the food. But of course, we know that's just put out by the lobbyists or the PR companies. But most of the drugs are really designed to treat the symptom of the side effects from eating junk food. If that's a huge factor. So if we kind of take a look at this whole thing, and it's costing us it's actually 4.5 trillion, not 4.3 a year. Yet we're getting worse and worse and worse. We have the worst health on the planet. And unfortunately, the doctor is usually not factoring in this one key piece of information of, what are you eating? The diet. They're getting them to eat real food. So this whole thing is held together by not introducing real food. That's really what this whole thing is held together. Now, what's even more interesting is, why does this involve you? Because you, as a taxpayer, fund a lot of the subsidies for the raw material for junk food: sugar, wheat, corn, soy, all this, crap. They get like 600 billion a year from taxpayers to pay for the junk food. So you're paying once, then you pay it again when you buy the junk food, and then you pay it a third time over here when you get your insurance premiums or pay the doctor. And not only that, we also fund a lot of the research from big pharma through NIH. And I'm like, wait a second. So in other words, we're funding a lot of the big pharma research where they get the patents, but as a consumer or an investor in this, we don't get any money back from that. We have to pay them. So this whole thing is kind of rigged to fail. It's a bad system. RFK is hopefully going to be getting in there to make some changes on this corruption, this conflict of interest situation. So I put a link down below, and what I would like to ask everyone to do after the show is write your senator, It's a real simple form. You just type it. You can just click it, put your name in your specific state. Write your center to insist that they support RFK going into the Health and Human Services as far as the secretary of that. Because if he doesn't get in for some reason, uh, I don't know how much is going to keep. I mean, is going to get changed. This is the same old going on. We have to break up this cycle, and it's going to have to be coming from the public, doing something about it. Because I don't like to pay for this. I don't like to support this whole model right here. So this is one way that we can fight back, just with putting pressure on the senators to make the right choice.
That's
And
very
I put that link
hopeful.
down below.
Yeah, good. I
Yeah.
hope that comes about. All right, why don't we go to our green room? And Kelby from Castle Rock, Colorado is on with us next. And he has one question, which he's going to belt out in 30 seconds. Go.
Hey, good morning, Dr. Berg. Huge
Hey.
fan. Thanks for taking my call this morning. Um,
Mhm.
Love all your content and all your products. Really appreciate everything you do. Try to follow your keto protocols and Dr. Davis and everyone that you recommend, and Bobby Parrish. Got a line of products here that have breads and tortillas that have very low net carbs. They seem pretty clean, high fiber. The first ingredient is resistant wheat starch. None of these products are approved by Bobby's app, by the way. Curious what this product is, if it's something that we should avoid, or your thoughts on that.
You brought up a really good point because I did some videos at the grocery store recently and saw those products, and the first ingredient was resistant starch. I'm like, well, I have personally have close people that have tested the resistant starches on their blood sugar, and you see the same spike. So there
Okay.
is this. It's like a hopeful, wishful thinking, like, wow, maybe the resistant starch will be the solution. But they'll also, even on the keto breads, the first ingredient is like wheat flour, and the second one is gluten extract. I'm like, what? So
Yeah.
unfortunately, just because it says it's keto or low sugar doesn't necessarily mean anything. You have to read the label. I'm going to be working really hard to kind of break this down and help people to navigate through these new ingredients. The other thing that they're using now as a so-called healthy is they're really jumping on these fibers, soluble corn fiber, or tapioca fiber. So
Yeah.
where's the safety studies? Like now we have to go into the fibers. Like, is that any better? Because everyone says, oh yeah, fiber is great. Yeah. So fiber is the only
They're
thing that
getting
our
pretty
bodies can't
creative.
digest. Yes, very creative. And so it's like the next thing and the next thing. So, and I think the best thing to do, unfortunately, is to spend the time to make your own recipe, make your own bread, make your own tortillas. Um,
Bummer.
I
Yeah.
do, I know, I do. I have found a couple companies that do have some products. I will be posting those very soon because we're going to
Okay.
release the app that you can scan these ingredients and kind of pick up the three bad things: the sugar, the starches, and the seed oils. So stay tuned.
Do you mind if I ask you a follow-up question on a comment you just made a minute ago,
Yeah.
about vitamin D high levels? Kind of along the lines of what you were saying, my PCP just told me to cut out my vitamin D because my level's at 120.
Yeah. So, first of all, there's no agreed upon consensus on how much vitamin D. There's different rules of thought. When you get over 100, now you get more therapeutic effects. But I would say I wouldn't let it get over like 200. But if you're within that range, mine's over 100. My wife's 150. There's a lot of data to show that when you have your vitamin D a little higher, it's more of a penetration through the resistance at the cell level because a lot of people have genetic issues with vitamin D. They can't get it in the receptors. And when you get your blood tested, anyway, for vitamin D, you're not testing the active form of vitamin D. You're checking the inactive form which very, very, very little of it is used for your immune system, for your muscles, your brain. That system, because there's two systems of vitamin D, is primarily used for your bones and the calcium. So, I mean, there's just more and more data on this, and this is the kind of the key point that I want to see if I can help clear up with this myth about vitamin D toxicity, because all you have to do is put a little doubt in someone's mind, like, oh, your vitamin D is too high, or doubt that, oh, are you sure you want your cholesterol that high? You might. So this is a PR tactic, and think about what vitamin D is up against, how many drugs that it can bypass. I mean, all the anti-inflammatories, Humira, which is the top selling drug on the planet, is an anti-inflammatory and autoimmune, which is in direct competition between vitamin D, high doses. In 1972, there's a great textbook. I did a video on this, talking about, they used to recommend 250,000 IUs of vitamin D3 every single day for various conditions. And now it's like, oh yeah, you just need like 600 or 400 IUs. I'm like, are you kidding me? So anyway, that's my thought on that.
Great call, Kelby. Thanks so much for that. I sure appreciate it. And Kelby, let's see how you do on the next question. There it is, Doc.
Hey, Steve. And so, and if you're watching, here's a good rebuttal to that. Say, Doc, what is the dangers of having my vitamin D that high? They're going to say, hopefully if they know, well, it's going to be too much calcium in the blood. That's the only side effect. Okay, well, can we test for that? Oh, yeah, that's an interesting concept. Yeah, we can test for that. Oh, it's normal. Okay, good. Then why are we worrying about it? So I think that would be the best thing to look at.
All right. Wonderful. Okay, Kelby, once again, look at that question, buddy, and add to the millions that answer the question.
Okay, so next question is, how does belly fat relate to a fatty liver?
Okay, climb on that, folks. Let's get back to our friends on social media, this time with Lori Ann from YouTube. How much cod liver oil should we consume on a daily basis?
I think, when you buy a bottle of cod liver oil, it's going to be in a liquid or a soft pearl. So I would honestly just follow the directions on it and take whatever it recommends, because obviously they have figured out how many omega-3s versus omegas, or vitamin A and vitamin D. I would just follow what it says on the label. Now, let's say, for example, you're trying to fix something. Let's say you had a stroke, or let's say you had brain injury, and you really want to raise your omega-3 fatty acids. Well, then you can start, doubling, tripling, quadrupling the dosage. So a lot of your brain is omega-3 fatty acids. And so why not give it more of that as a raw material versus the seed oils?
All right, very good. Why don't we find out if there is, in fact, anyone listening to the show globally? So here they are. I'd like to thank everybody, our viewers joining us today from the UK, Canada, Mexico, Italy, Albania, Ethiopia, Japan, Virgin Islands, Ghana, Armenia, Greece, Australia, Belgium, South Africa, Brunei, Sweden, Jordan, Oman, Denmark, Chile, Bermuda, the Philippines, Malaysia, Pakistan, Poland, Romania, Colombia, Jamaica, Scotland, American Samoa, Taiwan, New Zealand, Jakarta, Spain, the Dominican Republic, Switzerland, Germany, Hong Kong, St. Lucia, Egypt, Estonia, France, Botswana, Brazil, Qatar, the Netherlands, and all across these United States. So thank you, world, for joining us in the pursuit of health as described by Dr. Berg. Now, let's move on to individuals in that group. And Ita, Terry's going to chew me up for my bad pronunciation, from Facebook, what's your best advice to alleviate acid reflux?
Usually that is a problem, not with the too much acid, but the valve on the top of the stomach. Okay, so there's a differentiation because the valve is not closing, so we're getting a reflux into the esophagus. So you may want to try something very radical, which is to increase more acid And you may just find that it resolves your problem very nicely, because if you do the antacid, a lot of times it can go from worse to even worse. So what I would do is I would use something called betaine hydrochloride. It'll help build up the stomach acids. And you would start with maybe 4 right before a meal, and then slowly increase those until you have no more heartburn. So it might take some time, but you know, I mean, obviously don't take more than like 8 per meal. But the point is that when in practice, I had this little um, testing device, which I don't use anymore, but it was a little capsule with a string on it, and you would have the person swallow it and lay on the right side, and you're basically, you then pull it back up after 15 minutes, and you had this capsule that went into the stomach, and then it has this little thing where it can measure the pH. And what I found was shocking. Like, a lot of people with heartburn, if not all of them that I tested, had low stomach acid, or not enough stomach acid, so their pH was higher, which means it's more alkaline. So I mean, even to the point where it's like 4 or 5, like, wow, it should be 1 to 3, and it's way too high. So we would give people betaine hydrochloride, and that would help them. Now, the reason I stopped doing that is because one time someone had a dry throat, and it kind of got stuck. So here I'm pulling this string, like catching a fish out of their mouth, and I'm like, okay, I just cut the string, just swallow it, let it go through. I'm never going to do this again. This is like, yeah, I don't want to do this again. So that's what stopped that test.
Shocking. Okay, now here is quiz question number 2, which was already asked. And it asked, how does belly fat relate to a fatty liver? 85% of our respondents say that both are strong indicators of too much carb consumption. 10% say belly fat occurs because there's too much fat in the liver. And 5% say they're both signs of poor dietary choices in general.
Everyone's correct on that. I had 5 patients with bellies that I sent to the radiologist. I paid for all their visits just because I wanted them all to get scanned for liver fat. 100% of them had liver fat. I mean, just like the liver was like filled with fat. So there is a connection between the fat in your belly and the fat in the liver. And I think this is what happens. I think you start to accumulate fat in the liver, and then it gets filled up to the point where it spills off, and now it starts accumulating ectopically, which means outside the fat cell, around the organs. And you happen to have some extra space around in the midsection. It's kind of it's like a backup storage. So anyone that has a belly fat, suspect a fatty liver. It's because it's just spilling over. And also be thankful you have this storage so that you can get through the winter without eating so much. But of course, we don't do that. But it's like a survival mechanism, but it's definitely connected. And if you can't see your shoes when you look down, then suspect you have a lot of liver fat. So you need to get on a low carb diet to get rid of that.
All right, very good. Why don't we go back to our green room, and this time we've got Syed calling in. Go ahead with your one question, Syed.
Hi, good morning, doctor.
Morning.
Hope you are doing well. And I have been following you from Pakistan, and now I came to United Kingdom, England. And over here, from last few months, I've seen like there's no sunlight in this region in London. And and the second most important question is that my valve is open, and I was diagnosed with gastritis. Like the stomach lining was swollen, but no H. pylori came and nothing came. And it was all due to the stress and eating fast food at night from last 8 to 10 years and taking too much stress. So kindly tell me about that. And you're looking very handsome at this age, and God bless you, and God gives you more
Thank you.
health with wealth.
Thank you. So what you're saying is that they do have junk food in England or London? They do? I'm surprised. I thought, no, I'm not surprised. I know it's a situation. I've been there, done that. I have the T-shirt. I think one of the best remedies in addition to getting on the healthy version of the ketogenic diet, which I have all over my site and in my books, is to take a remedy called zinc carnosine. Okay. That is going to help you with your gastritis. It'll help heal it. And then I think the only vegetable that you should consume would be cabbage. That seems to work good. It has a certain ingredient. They used to have a vitamin U, which stand for ulcers, and that's in cabbage. And so it's good for ulcers and gastritis. It might be beneficial to watch our videos on the probiotics to start to build that up. But you don't want to take an acidifier for that because it's going to make it worse. You don't want to take betaine hydrochloride. You don't want to take apple cider vinegar. You just want to get off the junk food really quick, which I'm sure you've already done, and your diet's perfect right now because you've been following me for years. So, yeah, you basically created deficiencies probably of zinc, and you set yourself up for an inflamed stomach. And that's going to take some time to fix. It could take months. Be patient and be consistent. You will, within some months from now, you'll be doing a lot better.
Syed, thanks for a great call, friend. I really appreciate it. All right, let's go back to let's go to quiz question number 3. How about that? And Syed, I want you to answer this too. There you go, Doc.
Which nutrient is most important in repair?
All right, climb on it. Let's go back to social media, this time T67JHBB. Now, why would you come up with a handle like that? But God bless you. From Rumble, I take 3 of your K2D3 supplements every day and add 60 milligrams of zinc. Should I be adding copper to this routine as well? If so, how much?
Well, anytime you take zinc over a period of time, you want to make sure you take copper. You don't need a lot of copper. It's like a 10-to-1 ratio. So in other words, let's say you took 10 milligrams of zinc, you should just take 1 milligram of copper. But a lot of times people take 5 milligrams of zinc, and then they take micrograms of copper. So just kind of do the math. And I do have these ratios worked out in my trace minerals. Not that I'm biased, but that way, not only do you kind of get the right ratio of zinc to copper, but the other minerals too in the right proportion. But yeah, a good point with this copper, because there's a whole thing with copper, especially with people that have problems with transporting iron, keeping iron safely stored in the body. Because if you don't have enough copper, you can't transport it. And copper is needed also in the mitochondria. Copper is like an under-acknowledged trace mineral among a lot of different areas, and doctors especially, and even nutritionists. So yeah, don't forget the copper.
Okay, and we shouldn't also forget about some other people that feel left out, and they've chimed in. So we'd also like to say hello to those folks listening from Thailand, Singapore, Israel, Saudi Arabia, India, Hungary, Uganda, and for Syed, those fellow countrymen in Pakistan are also listening. So you have other people on the line in that regard. So thanks, everybody, for shouting out where you are coming from. Now, let's see. How about Cher from YouTube? Why would drinking hibiscus tea be bad for pregnant women? Is it?
Well, I don't know. I don't know. I'm not sure about that. There could be something in there. You can look it up. But anytime some of these herbs that they have, there's a lot of effects on herbs, and it could be that it increases something like oxytocin. I don't know. In which case you don't want to take it because it could actually create some premature contractions. The same thing with that L-Reuteri thing I recommend. You don't want to take that if you're pregnant because it does increase oxytocin. That is a hormone that can stimulate contractions. So maybe not a good idea.
All right. Well, the astute audience already gave us some answers on the third question, which asks, which nutrient is most important in repair? And 55% of our respondents say it's omega-3s, 25% say it's magnesium, 10% say it's vitamin C, and 10% say it's ever-popular vitamin D. Any winners there?
Well, everyone is correct. All of those help repair, and there's just a lot of nutrients that help repair. But there's something that's the highest of all of them, okay? And that would be amino acids, which is protein. So, that's the best thing to increase repair. This is why, like, if you're low in protein in your diet, good luck with repair. I mean, you also need high quality protein as raw material to build up your detoxification enzymes. All the enzymes for many things are made out of protein. So don't neglect having enough protein. In fact, out of all the things that helped me initially, it wasn't even lowering carb. It was increasing more quality protein from red meat, grass-fed red meat. That's right, red meat. The stuff that's supposed to cause cancer created the most positive change that I've ever had. Almost instantly, it felt great. It's good, high-quality meat is also good for blood sugars as well. So you might want to try that.
That's interesting. I guess that's why weightlifters eat protein afterwards, right? That helps repair their torn muscles. Is that the
I
same?
think they wouldn't need to necessarily have it right after. Just have it sometime during the day.
Yeah,
Um,
interesting.
because I mean, what is your muscles? Is it red meat? Could be.
Interesting. All right. Well, here we go with quiz question number 4.
Okay, what trace mineral is most important in detox?
All right, audience, climb on that. Speaking of the audience, Layla from Facebook, are liquid supplements more effective than supplements in capsule or tablet form? That's an interesting question.
Not necessarily. It really depends on the type of nutrient. Okay, the type of nutrient. Let's just give you some examples. If you're taking like a more bioavailable form of iron, is in like liver pills versus a regular iron oxide or ferrous oxide or whatever they have in the supplements. So there are better bioavailable vitamins if it's more natural, if they're in the complex, the complete complex, than just a synthetic isolated version of a complex. So yeah, you want to understand where it's coming from, the source of it, and the type of nutrient, not necessarily if it's liquid or a solid or an oil or whatever.
All right, let's go to Sapphire Queen. What a name. From Rumble, what's the best way to reduce inflammation in the body 2 years after having a stroke?
So I think one of the best anti-inflammatories you can take is vitamin D, vitamin D3 for sure. Magnesium is also very, very important, and also vitamin E. Vitamin E in the form of tocotrienols is very important after a stroke because it helps break down scarring, and that's important, especially in the brain. The problem with a stroke is it leads to something called the lack of oxygen hypoxia. So anything that can increase oxygen to the brain would be a smart thing. And one way to do that is to take the tocotrienols, make sure you do a lot of exercise, do hyperbaric. All of these things will help you.
All right, very good. Lynn from YouTube, what's the best? We spoke of plastics a little earlier as a follow-up. Lynn wants to know the best way to eliminate microplastics from our bodies. Would activated charcoal help do that, or are we?
I don't think so. I don't think so. The two ways to lower this exposure is to obviously get a really good water filter that can filter out the forever chemicals, and because it's not just about plastics too, it's nanoparticles of a lot of different things. Also, your water bottles are another thing. Start to be aware of all these inputs that might affect you, but then also the cruciferous vegetables, just a few times a week will help increase the detoxification enzymes. high quality protein will also do that. And that way you could just naturally get your body to limit some of the load and exposure, because it's going to be really hard to get rid of all those plastics out of your body. So I think another strategy is just to, instead of detoxification, because that can, you start pulling stuff out, it could be kind of very toxic. Just support the body's biochemical pathways so you can just get everything to work in spite of these plastics. So you might just need more nutrients to push things through these biochemical pathways.
All right, very good. And by the way, I'd like to say a shout out to the world's best audience. We've got a lot of things going on our show, and your guys' intelligent and quick responses to these questions really make it more interesting. And to that end, our fourth question asks, which trace mineral is most important in detox? And the audience, 72% of them say it's magnesium, 18% say it is zinc, and 10% say it's selenium. Are they as smart as I have claimed?
Selenium is the answer. Let me tell you what selenium does. That's a precursor to glutathione, which is one of the most important detoxification compounds in your body. So selenium is needed. And so you can't make it without selenium. And so selenium is in Brazil nuts, but it's also in shellfish and things like that. But selenium is involved with helping you get rid of excess hydrogen peroxide, because our body produces it, our immune system produces it as a kind of a byproduct. So as you age, you produce more of it, and this is why your hair starts to look like this, or right like this, the graying factor. You lose melanin from hydrogen peroxide. So this is why we need to strengthen our ability to get rid of this excess hydrogen peroxide with making sure we have enough selenium, so we have enough glutathione. Even in the mitochondria, one of the byproducts is hydrogen peroxide, which can lead to accelerated aging. So there are a lot of things that you can start to consume and eat to lessen that by building up these enzymes to help break it down, like catalase and glutathione and things like that.
All right, terrific. Here's our final quiz question of the day, Doc.
Which mineral is most important in energy production?
All right, that'll be an interesting answer. Mean Joe 75 from YouTube, please explain how consuming beets and beetroot juice can help someone with clogged arteries.
Well, there's something that beet juice helps people with, and it increases something called nitric oxide, which is a vasodilator, and it supports that layer of the inside of the artery, and so it helps with high blood pressure. It helps support the function of the inside of the artery, and beets are great to support that. And so there's even a beet powder that you can get to mix with water and drink that. That'll help your arteries. There's a couple other things that are really important with arteries. I should do an updated video on it, but I will say one thing. They've tested over 1,000 different compounds on the epithelial layer of the inside of the artery to see which one protected and helped it the most. And that compound was vitamin D3. So very important in preventing excess clotting, build up of plaque, is to have enough vitamin D3.
All right, very good. Let's see. Let's go to Zanya from Facebook. What's the best thing to do for irritable colon syndrome, or bowel, I think it's called?
I think I would not start increasing more fiber. I would go in a different direction and maybe do carnivore for a few months and see how you feel, or just start cutting down this fiber. It includes the fiber in things like beans and vegetables and things like that. And also the added fiber that they put in all these keto desserts that could just tear you up. So be careful of the fiber.
All right. Connie is among a huge group of people, and she, in this regard, wants to know what supplements are essential for someone who's had their gallbladder ripped out.
So when you take the gallbladder out, now you don't have a way of concentrating that bile and releasing it when you eat. It just kind of trickles down willy-nilly. So what you want to do is you want to um, see if you actually are deficient in the bile, and then start taking purified bile salts. Now, here are some clues that you're deficient in bile. The stool is light colored. Your stool floats. There's skid marks in your toilet. These are all indications that you're not breaking down fat, and so you might need some help with the bile. Then you just take this bile after a meal. But think about the reason why some people had their gallbladder out in the first place. They had a stone, and because they didn't have enough bile to break down the cholesterol super concentrated stone that they developed. So if they were to have enough bile in the first place, they probably wouldn't develop a stone. So, and there's also therapies out there that just use bile salts to help dissolve stones too. But then you take the gallbladder out and problem's gone, right? Well, you never address the bile. So some people need more bile salts, and I have a lot of videos on this. You can check them out.
Very good. Vicky from Facebook, what's the best way to get rid of neuropathy in your foots?
The best way is to take to get rid of the carbs and the sugars in your diet. That's the obvious way, but then you want to take benfotiamine. Benfotiamine is a type of fat-soluble B vitamin that helps to support circulation and nerve support in your extremities. It's great for peripheral neuropathy.
All right, CZ from YouTube, does taking vitamin D cause hormonal acne?
No.
Thank goodness. Okay, there you go, sir. Let's see. Hilda from YouTube, I have one kidney. What would you recommend to get rid of body parasites? Ivermectin, horse apple paste, goodness, or any other thoughts you have in that regard?
Yeah, I think unfortunately I'm not the guy to kind of recommend medications. So, but even though it's a repurposed drug, I think she said she's trying to get rid of parasites, right?
Well, yes.
And that is a dewormer. You know what? I mean, there's some interesting data on that. I can give you recommendations on natural dewormers, like wormwood extract would be good. Black walnut hull is another good one. If you have one kidney, then just take small amounts. But when you have to realize too, when you don't only have one kidney, it does compensate. It becomes bigger. It takes over. It compensates. But then again, I always, these herbal things, you want to kind of go lighter, err on the side of smaller amounts. Don't do what I did. Is I always like to, well, if a little is good, a lot more is better, right? So then I would take a lot of it, and I would end up in bed for 2 weeks detoxifying myself. So don't recommend it unless you want to kind of develop a secondary infection and have you just feel sick for a couple weeks.
All right, let's go to Danica from YouTube. How much of a factor is stress in trying to alleviate psoriasis? Boy, that's a rotten condition.
It is a huge factor, no doubt. So I think there's some great data on using light therapy, a very certain phototherapy that you can use for psoriasis. There's also high doses of vitamin D3 involved in that as well. It seems to work good. But those two areas would be important, as well as working on your gut. Some people go on carnivore and get rid of their psoriasis. So there's several things. You should watch my video on that.
All right, very good. Let's go to quiz question number 5, our final, which asks, which mineral is most important in energy production? And obviously our audience has an answer, of which 80% say it's vitamin D3, 10% say it's vitamin C, and 10% say it's high-quality proteins.
Well, it's a different answer than that. If you take a look at the energy factory of the cell, called the mitochondria, the food comes in there, and then it goes through a little breakdown of that food into the energy currency of the body. And we're dealing with kind of a chemical reactions and then physics that involve electrons. And so when it goes through all this huge assembly line, at the last step before it's turned into what's called ATP, there is a rotational motor. It's the smallest, most efficient motor in this world, and it's called ATP synthase. And it spins sometimes between 2 to 3 to 400 times a second. And every rotation, it produces, I think, 3 ATP. So it's like making just a lot of ATP with this motor. It's spinning. And that motor is dependent on a cofactor called magnesium. So without magnesium, can't make energy.
Wow. Fascinating what the body does. Let's see. Cass L from YouTube. Any dietary supplement advice for someone with Parkinson's?
So there's a medication called Deprinyl, I think it's called, that is very effective against Parkinson's. It's also an anti-aging. I'm not recommending it. I'm just saying that if you look up a natural version of that Deprinyl, which inhibits, I'm not going to get into the biochemistry, but it inhibits a certain thing in there that will help Parkinson's patients. So I have a video on this. It's not just a quick thing. It's a series of things that you have to do dietarily and nutrition-wise to help yourself. But I will say that it does involve taking niacin and several other things, as well as going on a low-carb diet, because we're dealing with neurodegeneration. And so look that up and get more information.
All right, good. Monica from good old Facebook. What do you recommend for thinning hair due to menopause?
I think the best thing is just to kind of reevaluate your diet and make sure it's really good. Make sure it has sufficient protein. Make sure you have enough B vitamins. Make sure you have enough trace minerals. But the most important thing related to hair loss, which I did a video on this, which is fascinating, is having enough vitamin D3, because apparently at that bottom root of that hair, there are a lot of receptors for vitamin D, and most people are deficient in vitamin D. So they don't have enough help from the vitamin D, and then you can't get the growth that you need. So you can't go through these cycles that a hair goes through. So you end up not growing it when the vitamin D goes downhill.
Okay. Brett 401 from YouTube. Would tea tree oil be a good way to get rid of pesky dandruff?
I think so. I think that would be one good remedy. I think rosemary oil also is one. Another one is castor oil. There's another one, oregano oil, thyme oil, sage oil. There's quite a few.
All right, very good. Here's an interesting, maybe closing question. Jonathan from YouTube, rank the healthiest milks for us in your opinion. Goat, bovine, almond, oat, and soy. Thank you.
Well, soy is going to be off the list, okay, because I never, ever recommend soy milk. I'm not crazy about oat milk, and even nut milk. Something like, it's kind of weird, like, is that really a milk? I think the top of the list would be the raw goat's milk or sheep milk. It's I think that's like at the top, and then then you get cow's milk raw. The thing is that there's two types of, there's like A2 milk that you want to get. It's easier to digest for most people. But of course, I know a lot of people who just like thrive on this milk, this raw milk. I like it in the form of cheese, high quality raw cheese. So that's where I get it. And also kefir and sometimes yogurt. But yeah, I'm all for this raw milk. People think that, oh yeah, raw milk is just so filled with bacteria. It's going to be so infectious. I'm like, do you realize who put that data out there? It was the Milk Association, the trade association, because they want to keep doing the pasteurized milk. Think about, you have this raw milk is a very natural thing, and it's when you pasteurize, you kill all these things in it. You kill all these enzymes. So you're eating like dead milk. Why is that healthier? Why not just get raw milk from a clean cow, or that's a farmer that's really taking care of their cows? But pasteurization allows the farmer to have a dirtier farm. So anyway, um, that's my opinion on that topic.
That's your closing
And
opinion.
on that topic, I think thanks for listening, everyone. Please fill out the form in the comment. I think you put a link down there, Steve. Hopefully, if not, we'll do it right away. But there's definitely let's try to support RFK to get him in there, because we need to clean up the corruption. We need more transparency, and I just don't like paying my tax dollars into the raw material for junk food, and also big pharma's research. Big pharma's research. Why am I paying for that? I don't even agree with it. So let's support him to see if he can get some of that corruption out of there. And have a wonderful weekend. We'll see you next week, same time, same place.